Air pollution linked to increased CNS tumor risk. Imagine breathing in the air around you could potentially increase your risk of developing a serious brain tumor. That's precisely what a groundbreaking study involving nearly 4 million Danish adults has revealed, linking air pollution to an elevated likelihood of meningioma, a type of tumor originating from the membranes surrounding the brain and spinal cord. But here's where it gets controversial. The research didn't just stop at meningioma. It also found significant correlations between prolonged exposure to various air pollutants, such as ultrafine particles, UFPs, fine particulate matter, nitrogen dioxide, and elemental carbon, and the formation of these tumors. This raises important questions about the broader impact of air quality on human health. To conduct their investigation, researchers drew data from comprehensive Danish national registries dating back to 1991. They meticulously gathered address histories and other relevant variables at both individual and community levels. By employing a validated model, they assessed residential air pollution and utilized a national emissions inventory to differentiate contributions from local traffic and other environmental sources. The primary focus of their analysis was the onset of the first primary central nervous system CNS tumor, as documented in the Danish Cancer Registry. Their study encompassed a variety of tumor types, including cranial nerve tumors, meningiomas, gliomas, and other CNS tumors. After analyzing the data, the team identified over 16,000 cases of CNS tumors, with meningiomas accounting for approximately 28% of these diagnoses. Notably, extended exposure to UFPs, fine particulate matter, nitrogen dioxide, and elemental carbon was associated with a higher risk of developing meningioma. For instance, a 10-year average exposure to UFPs was linked to a 10% increased risk, while fine particulate matter posed a 20% higher risk. Interestingly, sensitivity analyses indicated that traffic-related UFPs seem to have a stronger association with meningioma risk compared to non-traffic UFPs. However, when it came to fine particulate matter, there was no significant difference between traffic and non-traffic sources. The study also uncovered a surprising negative association between cranial nerve tumors and nitrogen dioxide exposure, suggesting that further research is needed to understand this phenomenon. Dr. Ulla Avidfeldt, the lead author of a study from the Danish Cancer Institute, emphasized the importance of their findings, stating, "Our study suggests that long-term exposure to air pollution from traffic and other sources may contribute to the development of meningioma, adding to the existing evidence that air pollution affects the brain, not just the heart and lungs." This research was published in the journal Neurology on July 9th and was funded by the Danish Cancer Society. While the study provides valuable insight, it's crucial to acknowledge its limitations. These include the strong intercorrelation and uncertainties in pollutant measurements, which might have affected the accuracy of personal exposure assessments. Other unmeasured factors, such as genetic predisposition, ionizing radiation, and occupational or lifestyle exposures, could also have introduced residual confounding effects. In conclusion, this study highlights the need for continued research into the relationship between air pollution and brain health. As we navigate the complexities of urban environments, understanding how air quality impacts our neurological well-being becomes increasingly important. What do you think? Should we be doing more to reduce air pollution in our communities? Share your thoughts in the comments below. How long-term air pollution exposure increases dementia risk. Latest research explained. Imagine a world where the air we breathe could silently increase our risk of developing dementia. This isn't just a hypothetical scenario. A comprehensive analysis of nearly 30 million people's data has revealed a concerning link between long-term exposure to outdoor air pollution and the onset of dementia. But here's where it gets controversial. While some regions show a decline in dementia cases, the global picture is far more grim, with the number of dementia patients expected to soar from 57.4 million to 152.8 million by 2050. This surge has profound implications for individuals, families, caregivers, and society as a whole. Recent studies have pinpointed air pollution as a significant risk factor for dementia, with various pollutants being implicated. However, the strength of evidence and the ability to establish a direct causal link have been inconsistent. To address this, Researchers from the Medical Research Council, MRC Epidemiology Unit at the University of Cambridge conducted a systematic review and meta-analysis of existing studies. By combining data from over 29 million participants across 51 studies, they aim to provide more robust conclusions about the relationship between air pollution and dementia. The studies, which included participants from North America, Europe, Asia, and Australia, revealed a significant association between three types of air pollutants and dementia. First, particulate matter, PM2.5. These are tiny particles, smaller than 2.5 microns, that can penetrate deep into the lungs. They originate from various sources, including vehicle emissions, power plants, industrial processes, wood-burning stoves, and construction dust. PM2.5 can remain in the air for extended periods and travel long distances. For every 10 micrograms per cubic meter, meters cubic, increase in PM2.5, the risk of dementia increases by 17%. In central London in 2023, the average roadside PM2.5 level was 10 meters cubic per cubic. Second, nitrogen dioxide. This pollutant, primarily from burning fossil fuels, is found in vehicle exhaust, industrial emissions, and gas stoves. High concentrations of NO2 can irritate the respiratory system, exacerbate asthma, and reduce lung function. A 10 meters cubic per cubic increase in NO2 raises the dementia risk by 3%. In central London, the average roadside NO2 level in 2023 was 33 meters cubic per cubic. Third, soot emitted from vehicle exhaust and wood burning. Soot can trap heat and affect the climate. When inhaled, it can penetrate deep into the lungs, aggravate respiratory diseases, and increase the risk of heart problems. Each 1 meters cubic per cubic increase in soot, as found in PM2.5, increases the dementia risk by 13%. Across the UK in 2023, annual mean soot concentrations at select roadside locations were 0.93 meters cubic here per cubic in London, 1.51 meters cubic here per cubic in Birmingham, and 0.65 meters cubic here per cubic in Glasgow. Dr. Haneen Craze, the senior author of the study, emphasized the importance of epidemiological evidence in understanding the link between air pollution and dementia. She noted that addressing air pollution could bring long-term benefits, including reduced healthcare burdens and improved quality of life. However, she also highlighted that the majority of participants in the studies were white and from high-income countries, suggesting a need for more inclusive research to understand the impact on marginalized groups. This study also found that while exposure to these pollutants increased the risk of Alzheimer's disease, the effect was more pronounced for vascular dementia, a type affecting around 180,000 people in the UK. This finding underscores the need for an interdisciplinary approach to dementia prevention involving urban planning, transport policy, and environmental regulation. In conclusion, the evidence points to a significant role of air pollution in increasing the risk of dementia. As we look to the future, it's crucial to implement stricter pollution limits and equitable policy interventions to protect public health. What do you think? Should more focus be placed on reducing air pollution to combat dementia? Share your thoughts in the comments. Midlife air pollution. How dirty air affects your brain faster than you think. Air pollution could be silently speeding up how quickly our brains age. And that's a reality many people still don't realize. Imagine going about your daily life in your 40s, 50s, or 60s, juggling work, family, and everything in between, without ever suspecting that the very air you breathe might be putting your brain's future at risk. But here's where it gets controversial. A new long-term study has uncovered a direct link between midlife exposure to polluted air and measurable declines in memory and brain structure. Let's break it down. Researchers spent nearly 30 years following a large group of adults, regularly assessing their exposure to air pollutants like nitrogen dioxide and fine particulate matter. These pollutants, mostly produced by traffic emissions and industrial activities, are known for their damaging effects on lungs and hearts. But this is the part most people miss. The strongest impact was seen in people aged 45 to 69, a stage of life usually not associated with brain vulnerability. Even after researchers accounted for each participant's childhood intelligence and any polluted air exposure earlier in life, midlife continued to emerge as the critical risk window for harmful effects on the brain. Why is this such a big deal? By 2050, the number of people worldwide living with dementia is expected to triple. That's hundreds of millions of people, family members affected. If even low to moderate levels of air pollution in cities and crowded suburbs can contribute to cognitive decline, as suggested by this research, public health strategies may need a fundamental rethink. Are our pollution limits really protecting our brains? Or are we dangerously underestimating the cumulative toll of invisible threats of the air around us? Thomas Canning, the study's lead author, put it bluntly: air pollution has been called the invisible killer and is the #1 environmental threat to health in the world. This statement is likely to spark debate. Should governments do more to monitor and lower air pollution, even in places where it's considered relatively safe? Could concerns about air quality become as urgent as those about cigarettes or processed foods? It's also worth noting, most of us don't notice a slow shift in our memory or thinking skills over the years. But layered exposure can cause subtle changes in brain structure and decrease cognitive performance, impasse that may only become clear decades later. Some scientists are now warning that we're looking at just the tip of the iceberg in terms of understanding the true health effects of air pollution. So here's a question for you. Do you believe current air pollution standards are enough to protect our brain health as we age? Or is it time to demand stricter regulations and better air quality monitoring, especially in busy urban environments? Share your thoughts below. Is this study a wake-up call or an overreaction? Let the conversation begin.